Welcome back, guys. This is kind of a part 2 to the dry needling video of what is dry needling. This is more of a why dry needling. Why would we use it here in the clinic? And I'm just going to use a shoulder pain as an example. Maybe you have a partially torn rotator cuff or you're post-surgical even. Dry needling has multiple benefits because it is a therapy that goes in deeper. We've done things like, we do things like scraping and factor and cupping and ART, and all those therapies are great for rehabbing the musculoskeletal system, but none of them really get quite as deep into some of that deeper muscle tissue or the underlying muscle tissue as dry needling does, because we can really go down to the bone essentially with dry needling. So we're getting in deeper. You can even get into the joint, into the cartilage if you need to, like in the knee or the labrum. So there's lots of different areas that dry needling is very effective in because of the depth that it can go down to, right? There's a few different techniques for dry needling. There's the one that I tend to use, and then there's the one that is traditionally taught. I call it PT dry needling versus, I guess, my dry needling, I'm not sure, but traditional dry needling is you take that needle and you go into the muscle tissue, and then you kind of wiggle that needle in and out and just really work it around that tissue. So you're essentially kind of using one needle and creating a cone of effect to really create a lot of damage to that tissue to force the body to heal it. That's really uncomfortable for the most part. I have a few patients that enjoy that style of needling. Most people do not stand it very well. So what I tend to do is use just more needles in the same spot. So instead of taking one needle and trying to treat a big area, I just put 3 needles in that same area. You get a very similar effect. And clinically, I haven't noticed a difference in patient outcomes using traditional, really what I would call painful dry needling versus more comfortable dry needling. But back to a little bit of why we use dry needling. If you have chronically tight muscles, a lot of tension, just you feel like you have knots and trigger points that just won't go away. You've tried massage, you've tried to work them out with your vibration gun at home, or you've tried cupping, you've tried scraping, and none of it's really getting there and really getting you the results you want. Dry needling is just going to get in there deeper. It's going to attack the body. It's going to force the body into a reparative mode to start healing that tissue. And I think you're probably going to get much better results, at least giving it a try. It's one of those things that if you can tolerate it, I highly recommend giving it a shot. We have great clinical outcomes here in this clinic, and no matter pretty much where you go, it is worth doing.